Hello, good morning. I hope you all had a wonderful 4th of July holiday. You were safe, you had fun, you enjoyed your time off. And today we are going to be chatting about acne and skincare. So the whole month of July, my goal is to hop on every other day, every few days, and share more in-depth information about skincare. We're going to talk about wrinkles and acne and autoimmune conditions. We're going to talk about nail health. We're going to talk about hair health. We're going to dive deep into that and try to keep each video relatively quick. So if you have any questions, thoughts, if you have protocols that you love to use, comment below, let me know on each topic and we'll go from there. So today we're talking about acne and breakouts, something that's just really common that a lot of people struggle with, and there's a lot of reasons that it happens. So of course there's dirt and oil buildup around the face that blocks the follicles, and then the body can have a breakout with pimples, whiteheads, blackheads, whatever it is, there's something going on. And then most people ferociously clean and try and figure it out. A lot of times as we get older and hormones settle down, the skin clears up. But as women go through menopause as well, it can come back. So there's a lot of things going on. Some of the main reasons that acne happens is because of hormones, of course, but also because of our skin being a major detox organ. If our other detox organs are struggling, the body will express itself through the skin. So the gut, of course, our lungs and our kidneys as well, and stress, of course. So I love to refer to the traditional Chinese medicine face mapping. You can Google it. It's on Pinterest. I will put a picture in the comments below, and it really helps you target where your acne is or there's issues on your face to what's going on in the body. So like right below the eyes right here is stomach, below that is lungs, and then right here is colon, and then kidney and bladder, and then the face is small intestine, bladder, and then heart. So a lot of times people are like, oh, I have a hormone issue, but it's actually a stomach issue. So that's really a great way to figure out what's going on, help minimize guessing, things like that. Okay, so how do I work with acne? Of course, we want to find the root cause. We don't just want to treat the skin, we want to treat what's going on. But for a spot treatment, I like to use just tea tree oil, and I'll take the bottle, flip it upside down, and dab my skin as well. Of course, after you wash your hands, because you don't want to take dirty hands on your oil bottles and then put it on your face. So make sure you wash your hands really well, keep your oil bottles clean, and keep your face clean as well. I also like to spot treat with things like frankincense. I'll also use Correct X by doTERRA, which is like a skin support. I don't want to say healing, but it's kind of like Neosporin. It helps keep the skin clear and healthy. And that's a good one, especially if you're prone to scarring. That will help support your skin, so it might not do that. Of course, you want to wash your face in the morning and at night. The most common thing that I see people do is that they wash their face with products that make their skin feel really tight. And what happens is when you wash your face and your skin gets really tight and dried out, it will actually make more oil, because that's what our skin does, is it creates balance. So the less oil you have on your face, the more oil your skin's going to create. So you have to break that cycle and use more gentle cleansers. Things like doTERRA's Essential Skincare line is perfect for that. They also have their HD Clear line. They're foaming. It's pretty bright in here right now, so it's hard to see that, but this is a really great way to clean your skin because it's not going to make your skin tight. And then you want to use good moisturizers, of course. I also really like to use the Yarrow Palm Serum by doTERRA because it has enough oil in it to stop that vicious cycle of washing your face, creating more oil, trying to get the oil off your face, and also supportive for the skin as well. Now, you want to watch what makeup that you're using as well. Some people are very sensitive. A lot of makeup is, of course, is clogging your pores and adding on layers to your skin, so it makes it more difficult to breathe. So using brands that are lighter in, of course, toxins, but as well as coating and protective for the skin. So you might need to change up your makeup. You want to wash or renew your makeup brushes, your applicators, your sponges, all of those things, because they're picking up on bacteria. And if you're reusing them over and over, you're just piling on more and more bacteria and infections. It can make it worse and worse, okay? Nobody wants to hear this, but you need to cut out gluten, dairy, caffeine, coffee, and chocolate. Those are the #1 aggravators for acne. Chocolate is the worst. Most people are very sensitive to it, and it shows up in their face. Instead of saying, oh, I get a headache or my stomach hurts, it's actually clearing out through acne. So those are my top foods that I would have you avoid. I would say, because acne can be a detox issue, walking, stretching, yoga, all of those things would be great to help move your lymphatics, clear your skin out, and help your body release that more effectively. And then for hormones, I use Claricalm Essential Oil Blend every day. Hip to hip is a great way to use it, just to help bring balance to your hormones, reduce that as well. Now, most people use that just during their cycle because it helps reduce cramps, helps feel better. But when you use it every single day, it'll actually calm your cycle throughout, and you will reduce acne over time. So that's a great one to use. Now, with supplements, you always want to be taking essential fatty acids, which is why I love the LLV kit from doTERRA, because it has those E-omegas in it. And what that does is it helps reduce inflammation on your skin. So if you have that redness, if your acne is really painful, that's another issue. And it helps soothe the skin. So skin is made out of fatty acids as well. Our cells are made out of fat and cholesterol. So we need healthy levels of that, as well as in our food, of course. You want to have healthy fats in your food. Avocados are a great source of that as well. Some other side supplements that I like to use are zinc and vitamin D. And one of my companies, MetaHerb, has a Dermaco supplement, which is excellent. And it has sarsaparilla, cleavers, Oregon grape, burdock, and yellow dock to cleanse the blood and maintain healthy skin. So that's another fantastic go-to to help support the skin as you're going through all of this. If you struggle with cystic acne, that typically leads me down the more hormone path. So we tend to work on progesterone with Chaste Tea or Vitex, Claricalm, of course, and running a hormone test, whether it's saliva or urine, like the Dutch test. Sometimes we do blood, it's just not as effective, or it doesn't give us all the information that we get from saliva or a Dutch test. So you want to run those and make sure that your testosterone is not too high or too low, because that can influence that as well. And before you start guessing and taking supplements for hormones, testing is the most important. I found over the past lot of years, 15 plus years, I've been doing saliva testing, that we really started in functional medicine with everyone's estrogen dominant. A lot of these women have PCOS and their testosterone's really high, and everyone just jumps to those protocols. But I've been finding with saliva testing is that it's usually the opposite. A lot of times estrogen's really too low. I've worked with so many women who have absolutely no testosterone, but they still have the cystic acne and the facial hair. So there's something going on with diet and the adrenals or the thyroid. So get your blood work done, get your hormones figured out before you keep stressing and buying supplements and nothing's working. So that is my quick acne support protocols, treatments, what I look at. So if you have any questions, let me know. If you have a favorite acne protocol, I would love to hear it. And the next time I pop on, we're going to be talking about wrinkles and how to help them and support your skin and love the skin that you're in. All right, guys, thank you for tuning in. I'll see you next time.